Parkinson's disease symptoms. Parkinson's disease, PD, is a progressive neurodegenerative disorder that primarily affects movement. Symptoms often develop slowly over years and can vary significantly among individuals. Motor symptoms. Tremor, often starting in one hand or arm. A resting tremor is a common early sign. It may also affect the jaw or foot. Bradykinesia, slowness of movement, making daily activities difficult and time-consuming. Rigidity, muscle stiffness that can occur in the limbs, neck, or torso, causing discomfort and reducing the range of motion. Postural instability, balance problems and a tendency to fall, often seen in later stages. Non-motor symptoms. Sleep disorders, insomnia, REM sleep behavior disorder, and excessive daytime sleepiness. Mood changes, depression, anxiety, and apathy are common. Cognitive impairment, memory problems, difficulty with planning and executing tasks, and slowed thinking. Autonomic dysfunction, symptoms like constipation, urinary problems, and low blood pressure upon standing, orthostatic hypotension. Parkinson's disease treatment. While there is no cure for Parkinson's disease, various treatments can help manage symptoms and improve quality of life. Medications. Levodopa, the most effective treatment, it converts to dopamine in the brain, helping reduce motor symptoms. Often combined with carbidopa to prevent nausea and improve effectiveness. Dopamine agonists, mimic dopamine effects in the brain. Examples include pramipexole and ropinirole. MAO-B inhibitors, help prevent the breakdown of brain dopamine by inhibiting the enzyme monoamine oxidase B, MAO-B. Examples include selegiline and rasagiline. COMT inhibitors, block the enzyme catechol-O-methyltransferase, COMT, extending the effect of levodopa. Examples include entacapone and tolcapone. Anticholinergics, help control tremor and rigidity by blocking acetylcholine. Examples include trihexyphenidyl and benztropine. Surgical treatments. Deep brain stimulation, DBS, a surgical procedure where electrodes are implanted in specific brain areas. These electrodes deliver electrical impulses to help reduce motor symptoms. Non-pharmacological treatments. Physical therapy, helps maintain and improve mobility, balance, and flexibility. Occupational therapy, assists in adapting daily activities to enhance independence. Speech therapy, addresses speech and swallowing difficulties. Parkinson's disease nursing. Nurses play a crucial role in the care of patients with Parkinson's disease. They provide support, education, and specialized care to manage symptoms and improve quality of life. Key responsibilities. Medication management, ensuring timely and correct administration of medications. Patient education, teaching patients and families about the disease, treatment options, and lifestyle changes to manage symptoms. Symptom monitoring, regularly assessing and documenting changes in motor and non-motor symptoms. Supportive care, assisting with daily activities, mobility, and safety measures to prevent falls. Emotional support, providing emotional and psychological support to patients and their families. Parkinson's disease pathophysiology. The pathophysiology of Parkinson's disease involves the degeneration of dopamine-producing neurons in the substantia nigra, a region of the midbrain. This degeneration leads to a significant decrease in dopamine levels, which is crucial for regulating movement. Key pathophysiological features. Lewy bodies, abnormal aggregates of the protein alpha-synuclein found in the brains of people with PD. These are a hallmark of the disease. Dopamine deficiency, the loss of dopamine-producing neurons disrupts the balance between dopamine and other neurotransmitters, leading to motor symptoms. Basal ganglia dysfunction, the basal ganglia, a group of nuclei involved in motor control, become less active due to the loss of dopamine, contributing to bradykinesia and rigidity. Parkinson's disease information. Parkinson's disease is a chronic and progressive movement disorder. It primarily affects individuals over the age of 60, but early-onset Parkinson's can occur in younger people. Overview. Prevalence, approximately 1 million people in the United States and 10 million worldwide are living with Parkinson's disease. Causes, the exact cause is unknown, but a combination of genetic and environmental factors is believed to contribute. Diagnosis, there is no definitive test for Parkinson's. Diagnosis is based on medical history, symptoms, and neurological examination. Imaging tests may be used to rule out other conditions. Parkinson's symptoms. Parkinson's symptoms can be broadly categorized into motor and non-motor symptoms. Motor symptoms. Tremor, shaking, often in one hand, even when at rest. Bradykinesia, slowness in movement, affecting the ability to perform routine tasks. Muscle rigidity, stiffness in the limbs and trunk, leading to reduced movement and pain. Postural instability, problems with balance and coordination, increasing the risk of falls. Non-motor symptoms. Cognitive changes, memory problems, difficulty concentrating, and executive dysfunction. Mood disorders, depression, anxiety, and apathy. Autonomic symptoms, constipation, urinary incontinence, sexual dysfunction, and orthostatic hypotension. Sleep issues, insomnia, restless leg syndrome, and REM sleep behavior disorder. Parkinson's Foundation. The Parkinson's Foundation is a leading organization dedicated to improving the lives of people with Parkinson's disease through research, education, and support services. Mission and activities. Research, funding innovative research to find better treatments and ultimately a cure for Parkinson's disease. Education and resources, providing up-to-date information on Parkinson's disease, including symptoms, treatments, and care strategies. Support services, offering support groups, helplines, and resources for patients, caregivers, and healthcare providers. Advocacy, working to raise awareness and advocate for policies that benefit the Parkinson's community. Conclusion. Understanding Parkinson's disease involves recognizing its symptoms, available treatments, the importance of nursing care, and the underlying pathophysiology. With comprehensive information and resources provided by organizations like the Parkinson's Foundation, individuals affected by Parkinson's can access the support and knowledge needed to manage the disease effectively and improve their quality of life.